What's up, everybody? This is Dr. Nick with Leverage Media, and welcome to another episode of Path to a Million podcast. This is our, we're kind of taking over the podcast to not really talk about growth right now, but more about how you should be handling the coronavirus situation. And so I'm going to be bringing on experts throughout the week that can give you different insights into different aspects of it. And so today I asked my frenemy, 𝗀𝗵𝘂 with AlignLife and Aceva nutraceuticals to come on and talk about how we can be making ourselves healthier through nutrition and things that we can do, but also what we can be talking to our patients about. So Joe, say hello to the people.
All right, Nick, thanks so much for the opportunity to come on. And yeah, I think it's a smart move, Nick. I think moving in this direction, we got to be convicted. We need certainty because everyone's searching for answers because the media's solution is stay home and wash your hands. Right. And I think there's a little more to what we can tell people to to navigate this landscape.
Absolutely. So I'm going to try to keep my sarcasm and snarkiness to a minimum. Joe and I love, Joe's from Jersey, and I feel like I'm an adopted Jersey boy just because we love busting each other's balls. But today we'll try to, well, we'll actually probably do it a little bit. There's no way to not, you know? First question is somebody with as good of hair as you have worried? One of the things that I worry about is someone with bad hair is what happens if I have to stay in my apartment for 3 months? Like, do I have to start cutting my hair, or like yours just like flows into this like wavy mane? I was like, man,
yeah, it's you know, it's the nutrition we're going to be talking about.
That's
if
right.
The right products, you would have the same issue.
There you go. Perfect. Now I know. All right. So the main thing there are two things that I really want to talk to you about. One is kind of nutritional, fact-based, research-based things that we can be sharing with our patients. And then number two is you own AlignLife. And so you have a lot of franchise locations as well as corporate locations. So I think you have a unique insight into somebody who's dealing with a lot of different situations and a lot of different regions. So I think you can give some insight into that. So let's start with the nutrition. What are some like core basic tenets that we can give to people? But then also, what's the explanation behind, like, you know, take vitamin C, take vitamin D, take zinc, like just I'll let you kind of go and I'll just jump in where I feel necessary.
Yeah, I'll prefer you just keep quiet. Let me just handle this part. No.
Fair enough.
Just kidding. So yeah, I think it's important to just start with the basics. I mean, everyone's going to go down these shiny lights in nutrition on every little thing that's out there in the market and get down these fads. But I think it's important. Let's get to the core of what can inspire a stronger immune system and where's the massive deficiency in the patient base. And not only patients, but the doctors that are taking care of the patients. We got to make sure our soldiers, our chiropractic warriors are taken care of. So, you know, to keep it simple, I would say you've heard the vitamin D story a million times. But at this time of the year, the level of deficiency, if you're testing your patients, your jaw's on the floor saying, how could these people have such low vitamin D, including the doctors listening to this? So I would highly recommend an enhancement of vitamin D. Research shows, you know, the respiratory risk, whether you look at the military studies or school studies, massive reduction in, increase in respiratory infection with low vitamin D levels. This infection that we're dealing with, this virus, is hitting the respiratory system. So it just makes sense. So as a general rule, if you're not testing, kick up to 10,000 IU for a month and then go back down to 5 after that month. That would be a general recommendation at this point for an adult. But I urge you to test if you can. And if you want more insight, you know, my company can help out and give you guidance, but at least raise the vitamin D.
And should they take it with food, empty stomach?
It's better.
And then also, like, with each one of these, if you could just give, like, what's the reasoning behind that, that somebody could easily explain to a patient?
Okay. Vitamin D, best taken with fatty foods. So a little coconut oil in a shake or an avocado and down your vitamin D. Not that it won't absorb, it just lowers the absorption. So not end of the world. take your vitamin D drops, 4 to 6 before going to work every day, and you're fine. Add a little fat, absorptions increase.
Gotcha.
Why is it, what does it do? Vitamin D is interesting. It increases your immune response, meaning your white blood cell count, but it also makes your immune system more paranoid and causes more autoimmune diseases. So whether it's infection or autoimmune, both options are not great if you have low vitamin D levels. So it inspires the immune function to work better and more accurately versus attacking its own tissue.
Got it.
The second thing, and these are basic, guys, you know these things. I'm trying to get some foundation for you, but vitamin C, there's enough research out there to fill my office right now showing vitamin C and immune function. These are basic components. I like taking vitamin C and doing a calibration. It sounds a little nutty, but when you take enough vitamin C that you have a loose stool, you know what your saturation point. Nick may need 10,000 milligrams. I may need 80,000 milligrams because I'm more compromised than he is. So to know what it is, too much vitamin C comes out the stool with a loose stool. So if you want to get through this fear or this pandemic that we're going through, you take a certain amount every hour, every 15 minutes, like about 1,500 milligrams every 15 minutes. Don't do this while you have a busy day at work. Do this on a Sunday. Right. And you'll have a loose stool. That's your cap. I'll tell you, I've had patients take 80,000 without a loose stool. What does that tell you? It means their immune is very compromised. And some after 5,000 say, I had a loose stool. They don't need a lot of vitamin C. Anyway, that's just a little nutritional nugget for you if you want to do that. If not, take 3,000 to 6,000 and enhance the immune system.
So if you do the calibration and let's say you get to 10,000 before the loose stool, now you know 10,000 is your number, and then from then on, how do you
lower about 30%, and then you'll start saturation, noticing a loose stool, and you go down, and theoretically you keep lowering until you really don't need but a very low dose.
Gotcha.
So that's how you would do it if you do that.
But how would you, like, once you knew the number? Do you do it every hour, every 2 hours?
No, then once a day, like you take your total consumption today, and let's say it was 30,000. Well, you know what? You hit it reduction between 30 and 50. So if it was 20,000, 10 to 12 the next day, and then just per day, and just split it in 2 doses. You don't have to do this every 15-minute thing.
Yeah.
Split it up.
So like 1 in the morning, 1 in the afternoon, Perfect. With food, with not.
Doesn't matter with the vitamin C. So you just split the dose in half, cut it 30 to 50%, and split the dose. Ride that through the next 6-8 weeks, and your immune system will be on track, optimal, if you do that in the vitamin D.
Perfect. And then any kind of description that we can give to patients on what exactly that's doing?
That as well literally increases the immune response, meaning the white blood cell count. The cells are going to be fighting the war of the virus. Yeah. So. All
right. Perfect.
Now, there's a lot of other herbs that we can dive into if we want to get more technical. We use eucalyptus, whether in a capsule or oil. It has a respiratory response to everything: asthma, COPD, bronchitis, and of course these type of viruses, because it's a respiratory issue. Those work really well. Thyme leaf has thymol in it that has a respiratory effect. It's been used in German hospitals for respiratory issues for years. So there's a lot of other things. I know your point today is not to get all the way nerdy on every herb out there and what they do, but to give some insight to the docs and the patients.
Well, so what I kind of would like is if we could have like 4 to 5 like very core basic things that everybody could tell everybody. And then if you want to get a little bit nerdy after that on a few other things, then so be it. So vitamin D, vitamin C, obviously. Are there any, like, what about like probiotics or?
I was going to say next one, let's put the probiotic in. The gut has a direct impact to the health. Why? Because the absorption goes down, immune system goes down. If you have bad bacteria in your gut, your body's fighting that and fighting the virus too. So clean out the gut, give the good probiotics. That's a very, very good move.
Are there any kind of quick and dirty, well, first on the probiotic, anything that you recommend in particular about that? dosage, how to take it?
There's a million types there. It really is the type of, then we get into nitty gritty on product and how they're formulated. You want a broad spectrum probiotic that has multiple strains, a broad spectrum on the strains, that's important. And how do you take it? Again, you can take with food, without food, doesn't matter. I would do it a couple of times a day to make sure it cultures in the gut.
Gotcha.
Have fiber because the bacteria eat fiber. So make sure you have fruits and vegetables so it has some food source to culture it in the gut.
And what if like produce becomes difficult to come across? Like, do you recommend 𝗵𝗵𝗶 to get your fiber in?
Yeah, you could take like a psyllium husk like 𝗵𝗵𝗶, or go outside and chew on the bark of a tree in your neighborhood. Okay, I had to get a little sarcasm in there.
Sure.
No, yeah, any type of fiber would be good if you can't get fruit and vegetables. Oat fiber, oatmeal. You said 𝗵𝗵𝗶, which is a psyllium husk. All that is good.
Got it. Okay. In terms of being able to clean up the gut, like what are some basic tips that people could recommend to patients to help heal their gut a little bit?
Yeah, that when we have offending antigens like fungus, like candida is common, is one thing, or other bacteria. Even eating more garlic. You're going to be staying home for 2 weeks, so you can eat more garlic. Actually, no, us chiros are going to be at the office, but having garlic is antiviral, it's an antifungal, that's good. And there's berberine is great for, that's an herb you can get in a capsule. That is great for killing off fungus, bacteria that would be growing in the gut. So those are a couple that would be great.
Got it. Perfect. What next?
So going into more, if we want to get into some herbs and some different things, if the patients are starting to get the sinus congestion, not the sinus, getting the respiratory infection, and what happens in this particular virus is it causes what they call a cytokine storm, which is an inflammatory response in the cell and then in the respiratory area. What happens is the virus grows in what's called the biofilm, which is like a layer of kind of like a mucus, where the virus kind of lays in, it divides. It's a very happy place for it's warm, it's moist, and it's a great place to keep its growth. Something like N-acetylcysteine is one of the things that will actually break up the biofilm and take the mucus and make it less, the viscosity decrease so that you can expectorate it out of the body. So I'm a big advocate of N-acetylcysteine for those two reasons. Break up the biofilm, so now the virus is exposed to your immune system, not hiding in a nice pretty mucus layer, but your immune system can see it and kill it. So in this condition, I highly recommend taking a little N-acetylcysteine. The side effect of...
Go ahead.
No, the side effect, not the side effect, but the complementary component is it converts into glutathione, which is your #1 antioxidant, which makes the immune system happy as well.
Nice. So if like, when should they start to take that? When they start to feel something in their chest?
Yeah. I mean, you could take it any time because it's a great antioxidant component. You can take it preventatively, but really when you start noticing it, any type of congestion, phlegm issue, take N-acetylcysteine before you start noticing an issue. About 600 milligrams a day is what you'd want to take.
Gotcha. And is that is that something that'll be sold separately, or is that like in a compound, or you could just like
we have it in our nutritional company. We have it in a blend with eucalyptus that I told you about, and bromelain, which is an enzyme to break up mucus as well. So we do it in a combination with about 4 herbs and the enzymes. But yes, you can also get it individually in products.
Great. And just to like, I would imagine that all the things that we're talking about are available online at Aceva.
Yeah, at Aceva, ACEVA. What we're talking about, that particular product we call Cyanide is a product. It's an immune booster, helps with sinus congestion and immune issues. So yes.
And if somebody needed some help, I assume there's people that can help in your company that could
Yeah,
point them in the direction?
if they want to give a couple of these things to patients during this pandemic we're dealing with, you just reach out to Aceva and our PhDs or dietitians or nutritionists support and help with any doctor that needs assistance.
And how's your supplies doing?
Right now, good, but right now it's starting to get heavy. It's interesting how quick supplies are dwindling. So, and getting new supplies becomes tougher.
Yeah.
So yes, right now it's okay. So if they do want products, sooner than later.
I gotcha. Fair enough. All right. Anything else in terms of kind of like basic stuff or anything that could be once people do start, if they do test positive, like things that they can do?
Yeah, I think all the other lifestyle components is worthy of discussing for a moment, and that would be.
I'm sorry. That is one thing that I was going to ask. I was, on some Facebook thread the other day, and David Seaman and other people were talking about the cytokine storm. So talk a little bit about, because he was talking about how to avoid that in the first place. What are your thoughts on how to proactively try to avoid the cytokine storm if you do contract it?
Yeah, it's basically what the virus does is viruses go into your cells and divide in your cells. They build up a cytokine, they burst open, and now you have this flood of inflammatory issue. So, the best thing to do is have your immune system maximized so we never get that issue. If you do have the issue, then we got to look at reducing inflammation. So one of the things we do is our liquid fish oil that we take at a higher dose to do a systemic anti-inflammatory response, or turmeric, higher level of turmeric to help offset the inflammatory issue. So those are the two things that I would do when we're in a heightened inflammatory response. And
would those be good things to be doing proactively?
Yes, that's a great thing to be doing just for our risk of heart disease, never mind this infection. So yes, right now, great time to increase your fish oil, increase consumption of turmeric. Yes, it would be great to do that.
And then anti-inflammatory diet, I would imagine, along with that. Yeah.
Yeah, so anti-inflammatory diet, and then let's look at the basics that we should be teaching our patients. Let's make sure we're drinking water, cutting our sugar, obviously higher fruit and vegetable intake. Sleep is essential for immune functions. Those lifestyle things, I would speak into the patients with conviction on that stuff, instead of just what's being said in the media right now.
Fair enough. All right, anything else that you can think of?
No, I can't stop talking about the conviction we need to have, because this is not a medical solution here. There's no surgery for this. There's no medication for this. When they go to the hospital, it's an IV and some medication for breathing, but it's not solving the infection. And really, it's our job, guys. This is like they're teeing this up for us. You don't have to switch our communication from economics to health or a mass shooting to health. They're coming in talking about health. Like, what do I do, doc? I mean, this is our lane. Yeah. You guys got to step into the lane, because the conversation is health right now. Right. And this is your space. So I think we should all be ready and willing and inspired to speak into the patients right now.
Yeah, I think right now, absolutely. But I also think that when we do get on the other side of this, I think that people are they're going to understand the above, down, inside out principle even more. And so I think this could really be a golden age for chiropractic after this passes, because we have the truth. We've got the answers. We just have to talk about that instead of always about, low back pain and neck pain. There's a place for that, but this is the time to be able to expand our reach.
Yeah, so Nick, look at a typical practice and how a doctor has to work what I was saying. We have to change the conversation to talk about immune systems in chiropractic while they're talking about golf or the football game. Yeah. It's just tough sometimes to make this transition. Now is the time where they're walking in talking about how do we enhance the immune system. So the beauty of what you're saying is you may have a 20% dip to the practice right now, but if you do your job in 3 months from now, when their child has an earache or their wife has a stomach virus, or you're going to think chiropractic because of what you're going to do in the next 8 weeks. Right. So the referrals are going to skyrocket. And I guarantee if you do it right, your PVA can go up literally 50%, because they're stepping away from back pain and looking at overall body function. So I
agree.
think this is a gift for us.
A gift is probably
little
is a strong word right now, but I think in the long run that I just think that it's going to be such a boon for chiropractic to be able to get back to talking about what chiropractic can really do.
Yeah, I agree. I'm a bleeding optimist, so I use gift a lot.
Know, right?
Gratitude and gifts all the
time. You're a gift to me, Joe. Anything else in terms of nutritional advice, supplementation, herbs before we move on to kind of what you're thinking about in terms of your practices and kind of what you're planning for?
No, I think it's also important that we talk about, getting their kids checked right now. They're off school. Let's inspire the immune system as a family, because when one person gets sick, the rest get sick.
Yeah.
I think it's worthy to talk about, where the virus lives. It lives in the air. So, we could clean surfaces all day. This is an airborne issue. So we have to increase the immune response, not just clean surfaces or whatnot. So looking at these nutritional components is vitally important. But don't forget what we're talking about in the lifestyle, and just make it a repetitious story. The sleep, the water, the cutting the sugar, the alkaline anti-inflammatory diet, the turmeric. Like, get this into a talk track. I'd recommend having a sheet that you guys write up that comes from your mindset or your heart on the things we talk about today. Make it a simple 5-step thing you have at the front desk, and then actually serve the patient with this information.
Yeah.
Now we can go down and deeper on looking at, I was saying, like lab test or gut test, but I don't think this is the time to get too deep in that.
Yeah. Right now, I don't know how many people are going out for gut tests right now. So I think just the basics, because I just think a lot of chiropractors, they just don't talk about nutrition that much. They don't think about it. Maybe they remember the stuff from school, but the reason I wanted to bring you on is to give them some actionable things that they can feel good about and know that it's coming from a good source, instead of just like what happens to pop up on their Facebook feed.
Yeah, the two other things is the zinc, going up higher on zinc. You don't want to go too high because it can be immunosuppressive, but 40 to 50 milligrams of zinc. We can go up to selenium. There are some biochemists talking about this. There's some bond in the virus itself that's broken by selenium. I've heard that. I haven't seen true research, but I've heard biochemists in some of our forums in the nutritional world are talking about higher level of selenium. So selenium's in a lot of high quality multi. So if you go a little bit more in selenium, that is very powerful. It's an immune booster, period. But in this particular case, it seems to have even more credence to actually fight against this particular virus. So
gotcha.
In summation, selenium and zinc found in most multis. You don't necessarily have to get another bottle of each of those.
Yeah.
You get a high quality multi. Ours is called Daily Balance, which is a foundation of all of those. And the probiotic, the vitamin C and the vitamin D. You can go elderberry, the eucalyptus, and these other things in addition. But if we're talking basics, those basics, I think it will get them through this particular issue.
Well, and I like having the basics that are proactive, giving them some health tips that are proactive, but then also because I like the idea of, like, if somebody does test positive, what are some things that they can do that they feel like they have some control over, versus just like waiting to see if they die or not, because I would imagine that a lot of people, when they get that positive test, that it's a scary time, because, from things that everyone's read, it can go downhill fast, and mostly with older people, but still, like, once you're in it, then all of a sudden you're like, well, maybe I know those are the statistics, but maybe I'm the one, so giving them some things that they can do to avoid it getting to severe symptoms, I think would be a great thing to be able to provide for patients. So I appreciate you doing that.
Yeah, no, I think it's a good conversation. I think it's also good clinically that we know when to refer. If they're having trouble respirating, obviously you're going to refer. So when the breathing issues start, share liability, share responsibility. But 85% of these cases are mild, where they're not even reported. So although the mortality rate, they're trying to claim 1 to 3%, They're also claiming the unreported cases is like 25 to 50 times reported cases, some astronomical number.
Yeah.
So if those are all reported and we reflect back to the mortality rate, I think it's coming down towards close to the flu. But the reality is it's very, very contagious. Yeah. So it is going to scale. I would also give comfort to your patients that let them know, no, it's going to go into the millions. Definitely. It's not like we don't have to watch this from 100,000 to 200,000 and 300. It's going to go into the millions, period. Yeah. So it is going to happen, and just expect that. Don't be shocked about it, because the worst thing we can do is cause all this fear in our patient base, which raises cortisol. Cortisol is adaptive to the immune system. Cortisol's low, immune's high. Cortisol's high, immune's low. That's just the way the system works. Yeah. So let's give them some grounding and say, that's just what's going to happen. So that's the discussion of contagious versus dangerous. Contagious, and I love what Dr. Franson was saying, pink eye is contagious. Is it dangerous? Not really, but it's very contagious. Yeah. This is dangerous if you're immunocompromised. Mm-hmm. So that's where you dive into the chiropractic work. Let's keep you from being immunocompromised, because it is contagious, and most likely we're all going to get it.
Yeah. So. Yeah. Well, and talking about flattening the curve and all of that, individually, I was talking to somebody today. I'm like, individually, there's no reason for you to be scared. If you're under 50, says the statistics. It's the fear is for society. The fear is for the healthcare system, not so much for you in particular, because they were like fearful of actually getting it. And I'm like, you don't really have any reason to be fearful of getting it. Even if you got it, it would be mild symptoms 99.9% of the time. It's that if the system gets overloaded, then people that have strokes, are dying in the hallway instead of actually getting care. And, it just takes away resources.
It's a good point, because the flattening the curve, it doesn't mean there's less cases. It means the peak is not as high. It's flat. Yeah. So that's a great point. Whoever's going to get it's probably still going to get it.
Exactly.
It's just more healthcare workers are available on the highest peak.
We are all going to be exposed to it. Some of us are going to get it and never get symptoms. Some of us just won't ever test positive because we have some kind of immunity to it. Some of us will get it and get terrible symptoms. Some of us will get it and die. That's the way every virus gets, especially new viruses. Nobody has any immunity. It's that right now it's like, do we have enough ventilators? Do we have enough respirators? Do we have enough hospital beds? Or doctors are getting sick now. And so it's like, I hear a lot of stuff on social about that this isn't a big deal. It's like, individually to you, it's not a big deal, but to our parents, to our grandparents, to the people we care about, the death rate goes up as there are as the system gets overloaded. People they're having to make decisions, like in Italy right now, on who lives and who dies, because they don't have enough doctors and beds to treat everybody. So that's really, and so I just want to make sure that we've got good information for the doctors that are listening here on how we can help educate patients, because I do think that they are less educated than we are on how the body works, why it's not a worry to be individually worried about this unless you're over 65.
And you make a good point. Our families and our loved ones, these basic nutrient and getting adjusted, yes, go to your grandparents, get them adjusted, give them the right nutrients, seriously, because there is a higher risk in the elderly.
Yeah. I do love that idea of this is the time to have them bring their kids in, because if they bring their kids in now they're starting to get it. Now they're starting to connect the nervous system to the immune system and the nervous system to chiropractic. So I think this is, like you said, it's a real opportunity to be able to start to expand this into family health. So let's talk about just practices in general, kind of where your head's at in terms of what kind of rules you're setting into place across your offices, and just anything that you've seen that sticks out.
Yeah. So the first decision is how do we present ourselves to the community? And we're very strong in our philosophy as chiropractors. We're not big germ theory mindset. So our knack is to be sneeze in my mouth, I got adjusted, So I think it's first to have some social awareness and social compliance. wipe down your table. You can do that to show the patient that you're at least having some social awareness to what's going on. It doesn't mean compromise your values. Don't adjust people because they got a cold, but have some social awareness to show that you're doing a part. That's the first thing that we decided to do. Maybe a little hand cleanser and wipe down a table between patients for the next 6 to 8 weeks. Yeah. The other things is if someone is sick, you know, you're going to still adjust, have them come at lunchtime or after, put a sign up that says, hey, if you're running a fever right now, give us a call before coming in the office if you start running a fever, and then we'll see them at 6. If you want them to wear a mask or you want them to just come in, wipe down the table, they go out the back door, open the windows after work, and just show that respect to the other patients. That's another level. So I think that's all good credence for the practice. Mm-hmm. And there's going to be some economic decisions that have to be made where patients are coming in, hey, I haven't been to work for a week. What do I do? Yeah. We just had a doctor reach out and say, what should I do? We can't make this payment. We either move the payment to the back end, or this gentleman wanted to forego until this is over. I said, I wouldn't do that. I'd forego this payment and then pick up next payment. So that was a gift to the patient. Yeah. The patient's like, why are you doing that? Why are you still having me come in? And he said, because your health and your immune system is that important. You need to get adjusted. And the guy's dropping tears saying, wow, you really believe in your work. And he says, you bet I do. Think of that patient's mindset and referrals next month. Yeah. You know, you lost the $90 here and you got 3 referrals because the guy's blown away that a doctor believes chiropractic affects the immune system that much, right? Yeah. Yeah. So those are some of those cognitive thoughts that we should be thinking through on the business side, keeping good awareness and being empathetic to the finance. We say, you know, we never turn away a patient for economics. We only turn away a patient that doesn't have commitment to their health, right? So if there's an economic concern, let us know. Let's work through this. This isn't a 5-year deal. We got to get through 8 weeks here. So let's all do our best to navigate through this. I would be careful not to be in a feared position because the media's in fear. The MDs don't really know what to do. Their scalpel's not working. Their meds aren't working. It's like a lifestyle thing until you need a respirator. So right. It's you guys that are going to have that deep breath. It's okay. I'm with you. If you don't have respiratory problems, let's work through a natural approach. We got this. I got your back. Yeah. That kind of conversation. Now, on the economic side, there are relief programs right now at the SBA, some emergency coronavirus relief right now. And I'd urge you to get it and just be prepared. You may not need it, but it's just going to feel good that you hold your conviction versus saying, oh, the rent payment. I don't want you feeling that in the next 4 to 6 weeks. Because to be honest, we're probably in the beginning stage. 4 weeks from now, we're going to be at a point where it may be a little tougher, and we want to have the economics to stand our ground because we are coming out of this. And I want everyone to know on this line, you guys are the warriors in the front line. We are getting out of this, and we're coming out stronger with a better philosophy that our patients are going to be hearing over the next 4 to 6 weeks. Yeah. So,
what on the SBA program, I've only been paying attention to like the paid sick leave and paid family leave stuff, and it looks like it got weakened today. The SBA, I assume, is going to be like credit lines.
Yeah, it's like a SBA. You don't have to have a current SBA loan, but they'll give you an SBA relief fund for Corona relief program. So if you we can get a link that you can use. I can send to you, Nick, and you could put on your podcast if you want, so people can reference that. But honestly, guys, if you have concern, don't wait till you're stressed. You can call your landlord. You can call your SB loan now and say, I'd like to go interest only, and do that for 3 months, and then pick up the equity, the portion of the loan after not the interest portion, but the what do you call it? The principal payments. Down the road. That's all okay, guys. That's all okay.
Well, you for sure want to be having the conversation, not waiting for them to call you to have the conversation. Like, be upfront, you know, whether it's with your bank or your landlord or your bills. You know, I think that there's going to be some relief on making payments, especially like to the government, whether it's like the 15th was Sunday, and so, you know, corporate taxes were due on Monday. So I would assume that most states are probably going to forego any kind of like penalties or interest if you're not able to pay right now. Yeah, I'm definitely making sure that we're protecting the cash piles right now instead of like making my normal like huge payments to this or huge payments to that, just because you don't know. Like, I mean, if the government says that you can't practice and you're out of practice for 3 to 4 months, you know, you want to make sure that you keep your powder dry for sure.
100%, 100%. And that'll get you through the short term, 6 to 8 weeks, but we'll get that link to everyone if they want to investigate.
Awesome. Anything else that your guys are thinking about or talking about in terms of the practice side or the financial side?
Yeah, we talked about the 3 different conversations to talk right now, the conversation of contagious versus dangerous to give people clarity. Yeah. We're going to be talking about immunocompromised. That's the word in the media. So you got to talk through that. What does immunocompromised mean? Mm-hmm. And then we talk about the things you should do and not do. The to do and the not to do list is something you can also be speaking to the patients about. We're also talking to doctors about doing Facebook Lives every day. Don't leave the office at the end of the day till you get on Facebook for 5 minutes. Mm-hmm. You guys are the celebrities to the community, whether you like it or not. They want to know what you're doing for your kids, for you, what you're eating, drinking, doing, how stressed you are through this. They want to know from you, believe it or not, you know, what you're doing, what you're wearing, what you're eating. They like it. So you'd be surprised in 14 days of doing a 5-minute Facebook Live, speaking from the heart about this condition in a proactive mindset is going to grow the business. So the residual is going to be big. So right now, first step is to create stability amongst your team and your patients. It's hold their hand, look your staff in the eye, grab your spine, teach how the nervous system is affected by a subluxation. Give conviction to your team right now. Give conviction to your patients right now. Next step is marketing. People are going to be sick and tired of this in about 3 weeks. They're like, I ain't sitting in my house anymore. Screw this. I'm not going through this again. I'm not going to work anymore. Like, that's the feeling in about 2 weeks. Right now it's fear. Then it's going to be a little bit of anger and frustration. And that's when they're going to be hearing your message even more in about 2 to 3 weeks from now. And in 4 weeks from now, start getting your health talks. Hey, can I come in your company and talk about how not to go through this garbage in the future? Let's get everyone's immune system lit up. Side effect, energy goes up, which makes us more productive. Who here wants more profit in our business and less time off? Every business owner is like, let me come talk to my group. So I'd like everyone on this line to be doing 4 talks a week in a month from now, 16 talks in a month from now. Blow up your practice.
Yeah. What are some, you mentioned that like in the nutritional world, like groups that you're in, who are some people that they could follow that are actually, I'm sorry, before that, I have been amazed by the amount of content that is being created by chiropractors during all of this. Now, I think that I just hit a tipping point and I finally convinced enough people to create content and that coronavirus was just like a coincidence. So I'm going to keep that in my mind, that's why everybody's creating so much content. But if we could just like keep that up, and with the type of content that's being created, I mean, we keep doing this after this is gone, we'll double, triple, quadruple the amount of people that are under care.
It's true. The political market, the economic trends, and all the defense systems of the world all follow Silveri's approach to his podcast. So everyone's watching your moves, and it is affecting the world. I
agree. So who are some people that they can follow that are really really sharp, really fact-based, that are putting out content right now in your world?
Oh, wow. That's a good question. There's 8 million people. I stopped watching. Now I'm just creating, so I'm not as in touch. But I believe the one that I see often, I think it's called nutritionfacts.com or .org, where it's just constant daily research on info that I really like. That's the one I've done lately. But a lot of the greats out there, authors and people that you see through searches or Facebook podcast, Facebook forums are just are collecting all the nutrition minds right now, and it's very vocal right now. So you can find content, as you said, everywhere you look.
Where are you creating your content? Where can they follow you?
So we are Aceva.com. So on our website, we're starting to do, it hasn't come out yet, but we're going to be posting some good research articles and info like I've been talking today. So you should see that. And then on YouTube, we're going to be posting some insight that they could watch.
On Aceva?
Yes.
ACEVA, correct?
A.com, yes.
Joe, that's not how it is on YouTube.
What do you mean?
I like the YouTube channel. Like no one's going to go to your website to read research articles. They want to watch videos of you breaking down this stuff. We've talked about your content strategy a lot of times.
Does Nick yell at all the hosts like he does to me? You guys got to help me out. Reach out to me. Give me some love.
You're a delicate snowflake. You need somebody to call you and be like, yeah, Joe, he was being mean to you. So on YouTube,
yes.
It's Aceva, ACEVA, right?
Yes.
Okay.
Yes.
And your website is aceva.com.
.com. Yes.
Perfect. All right. So if you guys need any of the supplements that Joe was talking about today, go to their website and you can order through there. Supplies are going fast. That is not fake scarcity. I think that is probably a real thing. So you might want to stock up now. Anything else? I always feel like you're so like grounded in your philosophy and your beliefs. So leave the listeners with some strong words of wisdom.
Yeah, I'm just proud of everyone on the call that's staying in the trenches and serving the community. This is the divine gift we had was the opiate crisis, which is there's no better movement for chiropractic than should I get adjusted or take heroin. Now we got a second gift, guys, right in our lap to say, what can we do for the immune system? And chiropractic study after study is showing T cells increasing, immune response, earaches, you name it. Our profession is primed up, ready to be teed off. It's our move, guys. It's our chance right now to step into the lane. We've let the conventional medicine take the lead in nutrition when it was handed to us 50 years ago. We've let them take the lead because we aren't speaking up. So following Nick's culture, Nick's advice, Nick's journey about getting you guys to do content, getting you guys to speak in his message that I've heard him give to you guys, that's where we're at. Follow Nick's lead in the contextual and strategic methods of how we get the content out, because you are the leader in your community and you have to step into the lane right now. So and I'm proud of all you guys for being on this and serving the community, because they need nothing more than your hands on people in the community.
Well, Joe, I appreciate everything you're doing. You're such a great leader and such a good example for people. And I really appreciate you taking the time today, and let's go fight the good fight.
Awesome, man. Again, I appreciate your authentic approach to marketing. You actually deliver it without the sensational side of it. You stay authentic to the message in chiropractic. And I think we need more people like you that are delivering that message to people. So I appreciate what you're doing. And God bless to everyone, and go get them. Let's see more people.
All right. We'll see you on the next one.
All right, buddy.